Welcome everyone to the Special Populations Core 2024 seminar series of the New Jersey Alliance for Clinical and Translational Science. Thank you for joining us for today's presentation focused on changes in healthcare visits due to cannabis following non-medical legalization in Canada. Before we jump in, if you have any questions throughout the presentation, feel free to unmute and ask or use the chat. We'll also have some time at the end dedicated to Q&A as well. It's my pleasure to introduce our speaker today, Dr. Daniel Myran. Dr. Myran is a clinician-scientist and assistant professor with the Department of Family Medicine at the University of Ottawa. He's also an associate scientist at ICES, where his research program focuses on using natural experiments combined with linked health administrative data to better understand the impacts of public policy on mental health and substance use healthcare visits and outcomes. He also practices family medicine with an interest in addiction medicine. We're very excited to have Dr. Myran with us today and are so looking forward to this presentation. So Dr. Myran, over to you.
So first of all, I apologize. I'm probably going to cough a bunch during this presentation. I have a nasty post-viral cough. But very happy to be here with you guys today chatting. People can ask questions at any time. So I'm here to, I do a lot of research tracking substance use harms and public policy in Canada. Most of my research is in Ontario, which is the most populous province. It's 14.5 million people. And today we're going to walk through some drug policy changes and some of the studies that we've done looking at what happened after them. So the research I'm talking about today has been funded by the Canadian government and the Canadian Centre on Substance Use and Addiction, and I have no other funding or conflicts of interest. So we're going to review some drug policy and cannabis policy in Canada and how the legalization, how the actual market has changed over time. I'm going to walk you through a number of different studies on changes in healthcare visits related to cannabis use across several different patient populations. And then we'll wrap with some public health and policy implications. So just as a quick overview, legalization is often kind of situated as this binary event where cannabis can be, illegal or legal. And my team and I conceptualize it more across a drug policy continuum or spectrum. And it can range from decriminalization, where you have removed criminal charges for substance use, in this case, cannabis use, but that it continues to be illegal. Legalization, where you've removed all of the criminal and civil penalties. That might be a fine or a citation that someone could get for possession or use of substances. And then moving on to commercialization. And that's where you have efforts by the government or the industry to actually increase the sale or consumption of a substance. And that can take a variety of forms, but usually looks like having widespread access to retail stores, having marketing and promotion of cannabis, having unrestricted product types, and usually operating sales through a private or profit-generating system. Recognizing this spectrum, when Canada moved to legalize cannabis in 2018, they convened a task force that put together recommendations on how it might be done. And if you look at this is kind of the framework that they operated under, where on the left, you have total prohibition of a drug, and on the right, you have unrestricted commercial promotion. And the idea is that there's a sweet spot in the middle where you have strict legal regulation, where you minimize health and social harms. And the thought is that, we started with, illicit or illegal cannabis, and that we wanted to move into a strictly regulated market, and that you can have an unregulated legal market or a less well-regulated legal market. And they gave the example of tobacco and alcohol, and the idea being that, alcohol and tobacco should be moving towards more strict legal regulation, and cannabis should be moving away from prohibition into a legal framework too. We're going to run through a couple of figures. This is the estimated total cannabis sales in Canada. And the black line shows, this is from all sources, The red line is illegal cannabis estimated, and the blue line is the estimated legal market, and gray is the medical market. And what I want to emphasize to you is that when we legalized cannabis in 2018, is that for the first chunk of time after legalization, the illicit and the legal market were estimated to be contracting and expanding at a pretty similar rate. But that around 2 years in, and you see that here, the legal market begins to grow much faster than the illegal market shrinks. And the thought is that Canadians are now actually consuming, or at least spending, more money on cannabis than they were at the onset of legalization. And here's a study that we did looking at how the legal market in Canada had developed over time. And this is is it very zoomed in for everyone? I'll keep going. So what you see is that the blue line here is the number of stores that are privately owned that increase over time in Canada. And these are different time points after legalization up until 4 years. And the orange line is public stores, and the gray line is the overall number of stores. But what you see is that in Canada, there's 13 provinces and territories, and 4 of them have opted for a public market where the government owns and operates the stores, and the remainder operate them through a private market where they're owned by private for-profit entities. And you see that the number of stores per person has increased very dramatically in the privately operated areas, and they remain quite low in the public areas. And you see similar patterns with cannabis sales. But what I want you to take away from here is that the legal market in Canada, and this is replicated across the US and states that have done it, it's not that you legalize cannabis and all of a sudden you have a fully fledged, mature cannabis market. It takes quite a number of years for the market to roll out stores. It takes a number of years for people to begin to transition from the illicit market, and that there really is growth over time. So we're going to switch over to looking at some healthcare visits. And when I talk about healthcare visits, we're using what's called population level data. So we have a universal health system in Canada, and the system captures every emergency room visit and hospitalization and the cause of them. And what we're specifically doing is we're using diagnostic codes provided by physicians in the treating team to identify events that are related to cannabis. And it's for cannabis intoxication, poisoning, induced psychosis, withdrawal, cannabis use disorders, and hyperemesis. And when we identify these events, they're typically where the treating team said that it was a main or contributing reason for each one of these ED visits or hospitalizations, and it's based off of clinical judgment. What we're missing, this is not chart level data. So there's no patient stories, there's no contextualizing information. We don't know if someone ate the cannabis, if they smoked the cannabis. We don't know if it came from the illegal market. We don't know if it came from the legal market, but we're going to track trends for everyone in Ontario or everyone in Canada in these health events. And we're going to start with pediatric poisonings. So, when Colorado legalized cannabis, there was reports of increases in cannabis poisoning in very young children. And Canada very intentionally implemented policies to try and prevent that. So there was restrictions on marketing, so they couldn't appeal to young kids. There was a 10 milligram THC limit in cannabis edibles. Everything needed to be in child-resistant packaging. And there was an intentional phased introduction of cannabis. So for the first year after legalization, there were no edibles, and then they came to market. And the thought was that this could prevent child poisonings, and we set out to understand if it worked or not. And as I highlighted, so in October 2018, cannabis is legal, and you can only sell dried flower, seeds, and oils. And then starting in roughly a year later, in December and in early January, the sale of new products come to market, including edibles. So you get concentrates like shatter, you get edibles, which is, a cannabis-infused beverage or a chocolate with cannabis in it. And you also get vapes, vape products and other stuff. And for the purpose of the studies that I'm going to show you, Ontario, Alberta, and British Columbia, which are we're talking about the 4 biggest or most populous provinces in the country. So they allow edibles to come to market. And Quebec, who's the second largest province, says that there's going to be no candies, no chocolates, and no sweets that can come to market. And I'll give you an example. So over here, this is kind of some of the products that are being offered legally in Ontario. So you have candy chews, brownies, chocolates, more candy chews. And the only thing that comes to market during the study time frame, and for those of you whose French is not fantastic, this is dried cannabis-infused figs. So they have these, and they're not particularly appealing to young children, but they have these dried vegetables and dried fruits that can have some cannabis infused in them. So this is one of the first studies that we did looking at cannabis poisoning in kids aged 0 to 9 just in Ontario. And we start in January 2016 and we go until March 2021. And these are emergency room visits. And what we saw is that, and you'll notice that the dots here are kind of all level, and we're actually suppressing for privacy reasons the actual value, but it ranged, there was, between 1 and 5 emergency room visits for cannabis poisonings in that month. And what we see is that in the pre-legal period, they're very rare. There's around 3 on average a month, or 2.7. That after legalization with no edibles, so restricted products of flower only, there's really no jump in the visits. And that during the commercial period, when edible cannabis comes to market, you see a large increase. If you just take the average across the 3 periods, this is 9 times higher. Each month, you get up to, I think, 27 visits on average a month compared to the pre-legal period. Children are also more likely to require hospitalization during the edible period. Almost 40% of them get admitted to hospital, presumably because the poisoning events have become more severe. But this raises a couple of questions. Are these poisoning events, are there real increases, or are parents, now that you have a legal substance in the house, more willing to disclose that their kid might have ingested cannabis? And we'll come to each one of these questions. There's been comments that, cannabis is benign and kids don't actually get poisoned. You'll see a constant theme throughout the presentation is that much of legalization in Canada has overlapped with the COVID-19 pandemic, and maybe these poisonings are occurring because kids are, home from school and getting into all sorts of poisoning events, and it's not just cannabis. And then the poisonings are coming from a sudden interest in illegal cannabis products, that it's not from the legal market. I'll address the first comment. So, is this parent suddenly more likely to disclose that their kid has ingested cannabis because it's now legal? And if we had seen a jump in period 1 right after legalization, that would be a reasonable explanation. It could be that, it's no longer an illegal substance. Parents might be less worried about Children's Aid Society getting involved, or their kids being, about social work getting involved. But that's not when we see the jump. We see the jump later in period 2 when the edibles come to market. So I don't see this as something that's related to a response bias or a change in reporting. In terms of whether or not these are real poisonings, I mean, these kids can get very, very sick. Many of them are admitted to the intensive care unit. Many of them require ventilation and breathing because they've actually breathing support, because they'll stop breathing from how the degree of intoxication that's there. So, these are not kids who are, kind of giggling and seeming well, but really acute poisoning events. And we work with pediatric toxicologists, and they comment on children who have seizures, children who have severe cardiac problems during these poisoning events. So they really are a major and immediate life-threatening event. To address the question about whether perhaps this is COVID-19 or a sudden resurgence in or a sudden increase in the illicit market, we did a follow-up study where we grabbed hospitalization data for Ontario, Alberta, British Columbia, and Quebec. And if you recall, Quebec is what we term our control, because they don't bring edibles to market. And what we see is that in the pre-legal period, so starting in 2015, and these are now hospitalizations, because hospitalization data is available across all of Canada. And we see that in the pre-legal period and during legalization period 1, when edibles have not come to market, that there's similar increases for all the provinces. But that during period 2, when the edibles come to market, we see that Ontario, Alberta, and British Columbia, who allow the sale of legal edibles, experience a further 3 times increase in rates of poisoning hospitalization. And that Quebec, who did not allow edibles to come to market or allowed, a small amount of dried cannabis figs to come to market, sees no significant change. And again, as you look at this, there's no reason to suspect that the illicit market surged only in Ontario, Alberta, and British Columbia, and that it only surged in places that actually allowed that type of legal product to come to market. And similarly, if we say, is this, and we're going to talk about this in a separate study too, but, is this COVID-19? Are kids at home, having poisoning events because childcare is closed, and that's the reason why you see this spike in poisonings? Quebec had a very similar COVID-19 experience to Ontario and not that disparate from Alberta and British Columbia. So the idea that there's something else that's going on here is really improbable. It's probably the legal edibles. So, as we think about what happened in Canada with pediatric poisonings, I think there's very clear and compelling evidence that the frequency and severity of accidental child ingestions of cannabis has increased. It occurred despite the government implementing multiple restrictions, and it really seems like legal edibles are a key contributor. At this point in time, 40% of poisoning hospitalizations in Canada in children aged 0 to 9 are actually caused by cannabis. I say the problem could get worse. Canada just completed their legal review of the Cannabis Act, and one of the things that the industry wanted was to get rid of limits on cannabis edible products. The review has said that they're going to stay in place, but it is a political process, and we'll see. We're closely monitoring to see what actually gets implemented. And just on so here's another study that we did tracking child poisonings before and after the COVID-19 pandemic. And I'll draw your attention here. So these are cannabis hospitalization poisonings, which, increased during the COVID-19 pandemic, which is when the edibles come to market. But if you look at all the other types of poisoning, so alcohol or Tylenol or over-the-counter medications or opioids or household cleaners or other drugs or, parents' blood pressure medication, none of those classes of medication is there any change in poisoning events. The only thing that went up was cannabis. And again, it really suggests that this is something to do with our drug policy choices and not the pandemic. I'm going to take so if anyone has questions about child poisoning, I think that that's a nice place to take a pause. And if not, I'm very happy to continue. And I can't see if anyone has their hand up. I'll give everyone maybe 10 seconds, and then I'll jump onwards. Okay, well, if you've got any, feel free to chime in at any time, or we can chat at the end. So we're going to switch tracks, and we're going to look at what happened with youth and adults and healthcare visits related to cannabis. And our studies here are going to focus on Ontario, which again is the most populous province in Canada and 14.5 million people. And we're going to track changes. And the reason why we're switching to Ontario here is that we have more individual level data. So we can start getting, we can look beyond just cannabis poisonings by age groups, but we can start figuring out, whether or not someone is pregnant or whether or not someone's been involved in a motor vehicle collision. And so it's a more flexible data set. We're going to track changes in a couple of different health outcomes, and we're going to also contextualize it by how the market evolved in Ontario. So Ontario actually had some of the most dynamic changes in in regulatory and drug policy over the legal period. So starting in October of 2018, the government actually, there was a change in government, and we switched from having a planned government-run retail system to a private retail system. So at the time that cannabis was legal, there was actually no stores because they were in the process of implementing a new private retail system. And the government felt unready to open a large number of stores. So for the first basically year and a half, there was a very strict limit on the number of stores, 67 for, again, 15 million people. And, there's the federal change where you can have limited products, and then starting in January, all these new products with higher THC content come to market. And then in April 2020, the government lifted its cap on retail stores, and there's, almost 2,000 of them now in the province. It's actually a graph. So the orange dots show the sales per person in dollars, and the blue bars show the number of stores per person. And again, you see the initial legalization phase in the province, where the only place you can get cannabis is online through a government website, and there's very little interest in it. People do not purchase a lot of cannabis. And during the phase that the stores begin to open, you see an immediate uptick in sales, and then the sales continue to open over time, or increase over time. And then as the cap is removed and the number of stores rapidly increases, you see that per capita sales goes up as well. Within all of this, for someone who's shrewdly looking at the mismatch between sales and stores growth, one of the things that has happened in Canada, and in particular in Ontario, is that there's a lot of discussion about how none of these stores actually make money, because there's been this huge proliferation of stores, and the sales have gone up, but not at all to the same scale. And there's kind of this interesting dynamic right now where a lot of cannabis stores are opening, but also a lot of stores are closing at the same time, and that the market is very much in flux. And what the cannabis retail market in Canada is going to stabilize into is still unclear. Here we tracked emergency room visits for cannabis use between 2010 and mid-2021. And we looked at it in adults aged 15 plus and in youth aged 15 to 24. And what we found is that visits for cannabis use have really been increasing since 2010. And it looks like they accelerated sometime at the end of 2015, which is around the time that the federal government said that we're going to legalize cannabis, and that the government changed the rules about medical cannabis, and it became much easier to access. Interestingly, in adults, during the period of legalization with very strict controls, remember, you have fewer than 67 stores, limited products, they're low potency, or have less THC content than some of the stuff that comes to market. The visits level off and stop increasing. And that during the period of time that the market begins to rapidly expand with new products and higher numbers of stores, which is also when the COVID-19 pandemic happens, you do see an uptick in visits, a sudden increase. And, again, we need much longer term data on what's happening, years after legalization, as the market has kind of stabilized and matured. And this is very consistent with cannabis use data. So again, if we go back to 2010 and we ask Canadians through a series of government-run surveys, which are nationally representative or representative in Ontario, whether or not they've used cannabis in the past year, and similar surveys about whether or not they use daily cannabis, you see that the number of people who use cannabis has almost tripled between 2010 and 2022. And, there's different surveys over different time periods, and there's room for debate about whether anything not accelerates after legalization. But really starting in 2014, 2015, cannabis use in Canada has been rising, and rising quite rapidly. And, with this initial work, some of the comments are, again, how much of what we're seeing is related to changing willingness to disclose cannabis use now that it's legal, or are clinicians more sensitive to it now that it's legal and in the news. And the same comment that I made before, I think, applies, that if we had seen a sudden jump in cannabis-related ED visits after legalization, you'd think this is disclosure, this is physician documentation. But the fact that, it actually levels off rather than continues to increase, doesn't go with that. And then when you see changes later on, this is probably not related to disclosure or documentation. This is certainly related to market evolution or to the COVID-19 pandemic, or likely both of them. And then are these increases coming from, the market evolving and commercializing, or the pandemic? And we're going to address that in a couple of follow-up studies, but we're going to basically compare people who can access the legal market because they're above the minimum legal age of purchase or compared to below. And we'll say, hey, if this is, COVID-19, people are stressed out by the pandemic, they're drinking more, they're using other drugs. That's why cannabis use is going up. We'll look at what happened with other substances. So here's another study that we did looking at changes in cannabis hyperemesis syndrome. So this is a condition where people have very severe recurrent episodes of vomiting. They often end up in the emergency room, profoundly dehydrated with severe abdominal pain. They're often not sure what's going on, and it appears related to daily or near daily use of cannabis, along with use of high THC products. And again, you see that this condition has really increased over time, and that there's a fairly large jump that occurs during the commercialization and COVID-19 period. What's interesting is that the jump only is for individuals who are above the legal age. So the legal age of purchase in Ontario is 19. And so you see the 19 to 24-year-olds and the 25 to 44-year-olds, they see an increase. People aged 15 to 18 who can't legally access the market, they've increased over time, but they see no increase during the commercial or COVID period. And we argue that that's some evidence that it's access to the legal market that seems to be driving rising visits. And similarly, here, rather than the denominator in our monthly rates being per person, we've done it per total substance use visit, or per mental health visit, or per vomiting visit. And again, we see that that there's been a much larger increase in cannabis hyperemesis, than there has been in substance use visits, overall substance use or overall mental health visits. Again, suggesting that this might be related to the market evolving. So I think that healthcare visits, the takeaway here is that healthcare visits related to cannabis use and cannabis use has been increasing since at least 2010. The changes appear to have differed by policy periods. They accelerated in the lead up to legalization. They kind of plateaued or stopped rising during this legalization of the restriction period, and have started increasing again during commercialization. And I think that there is some element of the pandemic contributing for sure. But I also think the data is hinting that, a more commercial market may come with adult harms. There's around 15 minutes left in the presentation. We're going to whip through a couple of different cannabis-related issues. So one of them will be cannabis and psychosis. So one of the big public health concerns is that cannabis use, which is associated with the development of psychosis and schizophrenia, is that rising rates of cannabis use will cause an increase in the prevalence of schizophrenia in society. So we did two studies, one tracking whether emergency room visits specifically for cannabis-induced psychosis had changed over time, and then another one saying, well, if these are increasing, which we show that they are, what happens to people? Do they actually develop schizophrenia after such visits? So here's a study that we published tracking changes in ED visits for cannabis-induced psychosis. The green line is just any cannabis-induced psychosis, and the purple line is what's called a first presentation or first episode psychosis. So this is someone who's had an episode of cannabis-induced psychosis and they have no history of schizophrenia, bipolar disease, or drug-induced psychosis in the past. And, again, some subtle changes during different legal periods. It plateaus during restriction, it jumps during commercialization. But the overall story that I think is important here is that there has been a dramatic increase in cannabis-induced psychosis in the past, 8, 9, 10 years. And, we're talking a 250% increase. And similarly, we see that the visits have risen much more quickly during the commercial period for people above the legal age of purchase compared to people below. We were next interested in understanding what happens to people. Does someone who has an episode of cannabis-induced psychosis or substance use for cannabis, and we looked at other drugs in this too, they've never been treated before for psychosis or schizophrenia. Will they go on to develop it? And so for here, we looked at 10 million people aged 14 to 65 in Ontario between 2008 and 2022. And we looked at the risk of developing schizophrenia over time after a first-time substance use visit. And schizophrenia gets diagnosed in, outpatient ED hospital settings. And what we found was, so 3 years out from it, so at the top, we're looking at cannabis-induced psychosis, and at the bottom, we look at substance use without psychosis. But an individual who's had an episode of cannabis-induced psychosis, of which there's a first time, and there's 3,500 of them in the study, within 3 years, 26% of them will develop schizophrenia. And that's compared to 0.1% in the general population, or a risk that, I've taken someone who is, 18 and male, and they've had an episode of cannabis-induced psychosis, and I compare them to someone who's 18 and male in the general population without one, and they have 241 times the risk of developing schizophrenia in 3 years. And even if you start adjusting out for, a lot of covariates to their socioeconomic status, whether they've seen a family physician before about their mental health, whether they've ever had depression or anxiety, the association still persists and is quite strong. And interestingly, there's a second group of people that we look at. And again, the cannabis, there's a larger signal for cannabis than there is for other substances like cocaine or alcohol or even methamphetamines. And then we also found that individuals with cannabis use without psychosis, so this is someone who showed up intoxicated and emerged from cannabis use, but they were not hallucinating, or they were not, having delusions of persecution or paranoid. These individuals actually, 2% of them in 3 years will develop schizophrenia. And because they're much more common, it's actually, they end up being a larger absolute number of conversions or cases of schizophrenia. There's very interesting differences by age and sex. So you see, so just for some context, males aged 14 to 24 within 3 years of cannabis-induced psychosis, 40% of them develop schizophrenia, which is twice the risk of females of the same age. So it's both true that the risk is very, very high for cannabis-induced psychosis and schizophrenia, and it's much higher for young people, and particularly high for young men. So, as we talk about psychosis, so ED visits for cannabis use and cannabis-induced psychosis have increased over time. These individuals are at very high risk of developing schizophrenia, and that there's unclear long-term implications on the burden of schizophrenia. And one of the reasons is that the average time between first using cannabis and being diagnosed with schizophrenia is around 6 years. So we legalized cannabis in 2018, we commercialize it in 2020. So really, if there's going to be any changes in the prevalence of schizophrenia, we'll start seeing it in a year or two, and we'll go on from there. So it's an area that I think is very important to keep monitoring. How are we doing on time? Well, we got a bit of time. Okay. Cannabis use during pregnancy. So, there's a lot of data that's coming out now that cannabis use may have adverse developmental outcomes for children who are exposed to it during pregnancy. And we were really interested in understanding whether or not cannabis use during pregnancy has changed over time in Canada. And the way we looked at it is through a proxy. So we said, let's look at changes in the prevalence of treatment for cannabis use disorder during pregnancy before and after legalization. And then let's also look at what happens to babies, the short-term outcomes of babies who are born from a pregnancy which was treated for cannabis use disorder. And we published this study here, and we look at so every quarter starting in 2015, we grabbed every pregnancy in Ontario. There's 1 million of them across the whole study. And then we say, what proportion of these pregnancies each quarter was treated for cannabis use disorder. And we found that, in the first year, two and a half years after legalization, the proportion of pregnancies treated for cannabis use disorder almost doubled. It increased by 82%. A really important caveat here is that these are rare events. There's 540 pregnancies over the whole study treated with cannabis use disorder. Before, when I'm talking about, just emergency room visits for cannabis use disorder, even cannabis-induced psychosis, those are common events. There you're talking about hundreds of thousands of people, or for cannabis-induced psychosis, 6,000, 7,000 people. Here we're talking about a very small number of pregnancies. But the public health concern is that for every pregnancy that's treated with cannabis use disorder, there's probably many more pregnancies where someone used cannabis during it or used cannabis regularly during it. And does this change? Does this increase in treatment for cannabis use disorder? Does it mirror larger shifts in the population of increasing cannabis use during pregnancy? And then we looked at the outcomes for some of these births, and we looked specifically at preterm birth, so before 37 weeks gestation, being in the lowest 5 percentile or less of birth weight, or being admitted to the neonatal intensive care unit in the first month of life. And we found that after adjusting out for a variety of different factors, the risk is about double. So 31% of these children ended up in the NICU, 12% were in the smallest 5th percentile of weight, and 17% were born preterm. All about double after adjustment of the pregnancies without care for cannabis use. We'll very quickly look at traffic injury ED visits. So again, one of the main concerns is that cannabis use may cause impairment and increase the risk of motor vehicle collisions. And we were interested in understanding what happened with traffic injury ED visits in Ontario after legalization. And we published this study as well, where what we did is we grabbed every emergency room visit for a traffic injury. And then we said, what proportion of these have documented alcohol or cannabis co-involvement? Where again, the treating team would have put down a diagnostic code for cannabis or alcohol. There you go. So the panel A is cannabis involvement and panel B is alcohol involvement. And, keep an eye on the y-axis. These are alcohol involvement in our data set is at least 10 times more common than cannabis involvement. So these are different scales. But we see over time that alcohol involvement in motor vehicle collisions is quite stable, whereas cannabis involvement has been increasing over time and may have accelerated again during this commercial period. The huge caveat is that COVID is such a major problem here. If you look at, patterns of traffic and, road use has all just enormously declined during the first couple of years of the pandemic. And there have been a couple of analyses kind of saying, hey, like road safety indicators, they're all pretty good for the couple years after the pandemic. And again, the critique that I would have is that first, the market was initially extremely immature. So even if you wanted to get cannabis, there was no stores to buy it, or there wasn't the types of products that you might want to use. And then during the time that, you have availability of cannabis, no one's driving because they're all at home. So again, this is not to say that there's been a public health catastrophe from legalizing cannabis on road safety. I think that the comment is that the jury is very much still out what the long-term implications are, and we need to keep monitoring it. Here's a nice study, not done by me, but I think really excellent about, they had a study set up where they routinely were collecting blood from injured drivers from motor vehicle collisions in British Columbia. And they were testing the leftover blood for the presence of THC. And what they found is that after legalization, the proportion of these drivers who were testing positive for THC and you can get a fine for being above 2 nanograms per mil, and it's a criminal offense for being above 5 in Canada, and that these things have doubled since legalization. So again, this is a pretty rigorous study with not a lot of biases that are going on, because this is just, no, people aren't consenting or not consenting to be in the study. This is just, we're grabbing blood samples from everyone who is moderately injured and needed hospital-based care, and they're finding increases in the presence of THC in people's blood. So again, certainly a warning signal. So I'm going to run through some policy implications, and then we'll have a discussion. So I think the first idea is that legalization with strict controls did not accelerate increases in adult cannabis use and harms. And I would argue that there's a substantial benefit from cannabis decriminalization that occurs through criminal justice harms. And I'm going to show you on the next slide, I actually think that that can be achieved without legalization and can certainly be achieved without commercialization. So here's police-reported cannabis crime in Canada. And this is the rate per 100,000 people, and the red line is showing legalization. We go from 2006 to 2021. Drug crime peaked in 2011 and was rapidly declining before legalization. It continues to decline after legalization, but most of the public health benefit that was occurring was actually happening before cannabis was legalized. So I could argue that you could get rid of some of these criminal justice harms, or most of them, or perhaps even all of them, without actually legalizing cannabis. And you certainly don't need to sell cannabis-infused candy or highly concentrated cannabis products like shatter in order to get rid of these criminal justice harms. So the second piece is that commercializing cannabis markets have almost certainly increased cannabis poisonings in very young children. And that occurred despite a variety of policies like child-resistant packaging and edibles limits. And it seems like if you choose to restrict the type of edibles that come to market, you can prevent a lot of this increase. One of the comments from the cannabis industry in Canada has really been to remove the 10 milligram THC limit because there certainly are illicit market products with very high concentrations. And one of the things that we have to be cautious of is that there's some excellent poison control data that's come out of the US showing that there seems to be a severe, a dose that kids can get into trouble is 1.7 milligrams of THC per kilogram. And what that means is that the average 3-year-old can be poisoned by 23 milligrams of THC. So there's really not a lot of, that these products, these THC contents, which are designed to provide intoxication for a naive adult user, are dangerous for very young children, and that there's not much you can do about it. You can't increase the limit for adult consumers without creating a toxic product for young children. And then the third policy idea is that commercializing cannabis markets can increase a wide variety of cannabis harms in young adults and adults. One of the things that's gone quite well is that it looks as though people below the minimum legal age of purchase have been relatively protected. But you look at this group, 19-year-olds, 20-year-olds, 21-year-olds, 22-year-olds, they can be quite sensitive to adverse mental health problems from substance use. We looked at a 19 to 24-year-old with cannabis-induced psychosis has a 40% risk of developing schizophrenia within 3 years. So this is a group that this young adult just above the legal age, I think, is a group that might be experiencing considerable harm from increasing cannabis use. The market's going to keep evolving and expanding, and that we really do need ongoing monitoring. And my parting thought is that cannabis use and harms were high and increasing well before legalization. We can have a lot of debate about whether or not, what has been the marginal impact of legalization. Did it make things worse? Did it make things better? Did restrictions kind of slow the harms and commercialization accelerate them? But the reality is that the burden appears to be growing and growing rapidly. And now that, in a place like Canada, which has a legal framework, it's an opportunity to start using regulations to try and reduce use and harms. So a big thank you to my research team. I think Jennifer's on the call right now, so maybe you can ask an insightful question at some point. And lots of great collaborators. And here's some of the references that we did. And if anyone, I'm looking forward to a nice conversation right now, and people are welcome to reach out and here at my Ottawa hospital email.
Thank you so much, Dr. Myran, for the presentation. If anyone has any questions, please feel free to unmute and ask. can get us started. So you mentioned at the start of the presentation, this idea that tobacco and alcohol use becoming more regulated, moving cannabis towards a legalized market. And so I'm curious about the overall landscape of legislation around substances in Canada, and how is alcohol, tobacco, is it moving to more restricted use, and how that environment may influence all substance use, but cannabis use in particular.
So the general route is that tobacco, Canada has very, very strict tobacco regulation. I'm not an expert in tobacco regulation, but Canada has very strict tobacco regulation, and that it continues to move forward. Canada has what's called a tobacco endgame, where the plan is that by 2035, fewer than 5% of Canadians will smoke cigarettes. There's now every cigarette in Canada will soon have a warning label on it about harms. Canada's been, one of the first movers on graphic warnings, plain packaging, advertising. So Canada generally has much stricter tobacco regulations than the United States, and is a world leader. For alcohol, Canada has been in the process over the last several decades of deregulating alcohol controls. It depends on the region in the country, but we have very poor marketing controls on alcohol. There is, in general, a move towards dismantling government monopolies who sell alcohol. Ontario, where I live, is in the process of privatizing much of its alcohol infrastructure, and is going to open, we currently have 2,300 alcohol stores. We're going to open 8,500 additional ones over the next 2 years. So the movement towards alcohol is towards deregulation. And one of the comments that I often make for people who are asking, if when Germany is saying, hey, should we legalize cannabis, is that you can have wonderful public health intentions at the start. You can have a really tightly regulated framework. It can have public health oriented regulations. Is the public health community able to be committed to a long-term fight with vested interests who want to deregulate a lot of those policies that are in place? And that I'm not so sure about. I think that, we've won many nice victories on tobacco, and we have a really mixed track record for alcohol. And I think that cannabis is being regulated and conceptualized much more closely to alcohol than it is to tobacco. And I'm not sure that, 10 years from now, that if our cannabis policies will be much more in line with our alcohol policies than they will be with our tobacco policies.
Thank you. Steve, I see you have your hand raised.
Yeah, hi. Thanks for so much for doing this fascinating presentation. The scientific question as to the causal relationship between smoking alcohol for certain young people and developing schizophrenia is incredibly important, and I think subtle. So maybe it's I think the details of the studies are important. So the question being, a 19-year-old presents with cannabis-induced psychosis, and that person is not diagnosed with schizophrenia at that point. But if you look at the whole process through which schizophrenia unfolds, which is sort of this gradual cognitive change in thinking, schizophrenia has prodromes, and there's a lot of emphasis on the first psychotic episode, which may or may not be schizophrenic. So you see what I'm saying? That the design of the study, because that could be two different scenarios. These could be early symptoms of a schizophrenic mind starting to decompensate under the stress of the cannabis, or it could be truly a new shock to the system that creates a case of schizophrenia that would not otherwise have happened. Now, that's not an easy question to research, but I'm curious as to your thinking about it, and what do we truly know about the causal relationship?
Sure.
And what kind of research do we need to do to get a clear fix on that with so many more people exposed now?
Yeah, so I think that, the study that I presented is not a causal study, right? It's a observational study looking at an association between cannabis-induced psychosis and schizophrenia. There is a very large and extensive body of literature on this topic with a whole host of different methodologies. And really, there's three questions that, three explanations of this association. So one, there is a group of individuals when exposed to cannabis who develop schizophrenia, who in the absence of that exposure would never develop schizophrenia. The second is that there is a shared set of genetic and environmental factors that predispose people to cannabis use and schizophrenia, and there's actually no relationship, right? It so happens that people who have this set of genes and they get a lot of adverse childhood experiences, they use a lot of cannabis, they also develop schizophrenia. And the third is that individuals who have early psychotic symptoms actually self-medicate them with cannabis. So they're sitting there, it's very unpleasant to have feelings of psychosis, and that there can be some numbing or some self-medication. Now, it's possible that all three of these things are at play. There are really strong genetically informed studies that are using like whole genome, and I am not a genetic studies guy, but are using genetically informed methods. There's decent studies using brain imaging. And I think the group of them are together suggesting or are reinforcing this epidemiological signal of the association between cannabis use and psychosis has some very concerning, is holding up with genetic methods and is holding up with brain imaging methods. And it's not definitive, the case is not closed. But if I was to bet on something, it is that some proportion of cases of schizophrenia occur because of cannabis use and otherwise would not. And I think that what the literature is hopefully going to resolve is a better sense of what proportion. Now, you can go talk to another you can talk to a psychiatrist, and you will find plenty who are saying that this is not a real association, but you will find many, many psychiatrists and many researchers who are saying that this is capturing a causal process. And, again, we work closely with two clinicians from the First Episode Psychosis program here in Ottawa. And what they've said is that since legalization, it has been the rule rather than the exception that first episode psychosis have heavy cannabis use involved with it.
Yeah, those are all pieces of evidence, and you can understand very much why people would be somewhat talking past each other, because I think we don't have still to this day the solid evidence to know how that relationship is really working. And presumably that relationship doesn't just exist for people under 18, it also exists for people who are newly eligible under recreation laws, young adults.
Yeah, and again, I think that what I would say is that if you apply the precautionary principle here, that this is a very concerning warning signal. And again, when I talk about this, I say certainly if there is a family history of psychosis or a personal history of psychosis or bipolar, you should be staying very far away from cannabis until your brain is done maturing. And I think that message has largely been lost. Not just the family history, but the idea that cannabis use is now legal and you are 19 and you can purchase it legally. To say that, you should go purchase shatter from the government, which can have 90% THC, and, or a vape pen that has 40% THC, and use it every day and everything's going to be fine, is a very bad public message to have, and is doing a disservice to young people who I think have more of a right to understand what the potential warning signals are about the use of the substance.
So you would change this not with legalization, but with other steps short of legalization?
I like if you would put me in charge of Canada's drug policy and I had
We
done
just
this all,
did.
Yeah, sure. I would have said we should, we should rapidly move to stop giving, young Black and Indigenous Canadians criminal records for minor possession of cannabis. And we actually were doing that in the lead up to legalization. And I would have said, if you want to sell if you want to legalize cannabis for non-medical use in the country, I would have regulated it very similar to how tobacco was done, that there'll be a small legal market, predominantly through the government, with strong financial disincentives for higher potency cannabis products, high minimum legal ages. And the idea would be is that a small number of adult consumers might get cannabis through these highly regulated sources, and that the move in Canada, the balance has been all about displacing the illicit market. The narrative has been, we have to get rid of the illicit market. We have to get rid of the illicit market. Everyone's very upset that there's still an illicit market. And, getting rid of illicit markets takes time. And I think that fully removing the illicit market in Canada would come with massive collateral public health concerns, that you actually don't want to completely eliminate the illicit market, because you would set up a very scary and ugly looking legal market to do that.
Thank you. I see Lisa and Stanley. Lisa, I'll go to you first.
You have been a clinician working at a large university in the United States with young adults for many years, and we saw an increase in the numbers of students with what mental health clinicians would call anxiety disorders, as well as social anxiety, with increased cannabis use, but not only just occasional use, but regular use. And I know your study focused on psychosis and schizophrenia, but I just wanted to add that and see if you had any thoughts of that, because these are they don't meet the level of psychosis that you're describing, but we did see tremendous increase in those diagnoses also.
Yeah, thanks, Lisa. So actually, we've done a similar study. I didn't have time to present it. We just published it. I can, maybe there's a way to share references at the end, but what we found is that individuals who have no anxiety disorder at baseline, people who have an emergency room visit for cannabis use have 4 times the risk of being diagnosed with an anxiety disorder within 3 years compared to someone who doesn't. And that individuals who have anxiety, which has been treated as an outpatient basis, so that, you've seen your family physician, I think you guys see internal medicine for primary care, but in Canada, we do family medicine only. But you've seen your primary care provider for anxiety before, but you've never been to emerge for a panic attack. You've never been hospitalized for severe anxiety. Those folks, if you use cannabis to the degree that you have to end up in emerge, you are also 4 times more likely over time to require ED care or hospital care for anxiety. So I think that the signal for severe anxiety disorders from heavy patterns of cannabis use is also there.
Stanley, do you want to ask your question?
Sure. Thank you for an excellent talk. Very nice data analyses. Just 2 things. I'd like to put in a plea for those who are involved in helping develop regulatory processes and data processes to track separately and record separately the mode of use of cannabis, especially smoking versus edibles. I think the long-term consequences are likely very different, and that a number of authorities have decided to simplify their task and not track the difference, even in terms of sales. The other thing is, you had some wonderful references. I'd love to get a copy at least of your reference page, or perhaps even just your entire PowerPoint if you're willing to share it. You have nicely depicted many of the important studies.
Yeah, sure. That's I can work with Kylie to share something after.
Thanks.
Well, we are just at time. So just want to thank you so much for this really wonderful presentation, Dr. Myran, and sharing this expertise with the NJX community. We're really grateful for it and appreciate the opportunity to learn from you. And of course, want to thank everyone for joining as well, asking such great questions. So thank you. Take care, everyone, and we'll see you at the next seminar.
Have a nice day, everyone.